We had large population studies that were done primarily in the United States. So the Framingham study is from a small little town outside Boston. They've been studying these people for 50 years plus. And they found that patients that had blood pressures of around 120/80 tended to do better, less heart attack, less stroke. In the women's health study, in the nurses study, patients that had blood pressures around 120/80 did better. So those are population studies, but then we like research studies to say, okay, well, what if we get people whose blood pressures are higher than 120 and we lower it? Does that provide a benefit? And the answer was yes. And there was a big study called the SPRINT study in patients that were relatively high risk, a high Framingham score, or maybe they had some kidney disease, or maybe they had some heart disease. And we lowered their pressure and really tried to get it to 120/80, and those people did better. They lived longer.